My talk, as you mentioned, is about medication used for chronic health conditions in Saudi adults, which is part of the results of a national household survey. First, a brief introduction about Saudi Arabia. As you know, it's located in the Middle East with a population of around 30 million, and 70 to 75% Saudis. Other people are expatriates. Gross domestic product is around $750 billion in 2014, and total pharmaceutical expenditure is around $3.5 billion. If we look at the global burden of disease study results for Saudi Arabia, this big square shows the total amount of DALIs in Saudi Arabia. As you can see, the bluish part, which is non-communicable disease, is the main component of disease burden. And diseases like as diabetes and ischemic heart disease are big chunk of total burden of disease. If you look at the risk factors, the main risk factors of disease burden in Saudi Arabia are high body mass index, high fasting glucose, plasma glucose, dietary risks, and high blood pressure. In this study, which was the Saudi Health Interview Survey, or SHES, and was performed through a collaboration between Saudi Ministry of Health and University of Washington, we did a household survey in 2013 on a nationalist representative sample on around 10,700 people from all 13 regions of Saudi Arabia. We collected data through interviews, physical exams, and laboratory testings. We asked from all people who reported a diagnosis of chronic conditions about the medication use. And the interviewers observed containers of drugs, and then we converted all these drug names to generic names and classified them based on ATC classification, which is the anatomical therapeutic chemical classification. You may know this classification. It's designed by WHO Collaborating Center on Drug Statistics Methodology, and it has a 5-level categorization. Level 1 are 14 main categories of anatomical or body system organs. Level 2 to 4 are based on a specific pharmacological, therapeutic, or chemical characteristics of medications. And level 5 is the unique name for each drug. For example, for metformin, category level 1 is category A, alimentary tract and metabolism. Level 2 is A10, drugs used in diabetes. Level 3 is A10B, blood glucose lowering drugs excluding insulin. Level 4 is A10BA, biguanides, and level 5 is the drug name, which has a specific code. And a summary of findings. At 11.8% of Saudi adults reported at least one medication for chronic health conditions. In both sexes, medication use was concentrated in older adults. 75% of younger population use only 20% of all medication, and the other 80% of medications are used by the older 25% of population. Some factors were associated with taking medication for chronic health conditions, such as age, male sex, and higher household income, which were related with higher intake of medication for chronic health conditions, and high education and living in the regions outside the Riyadh's capital region were related to, were associated with lower taking medications. If we look at the different levels of ATC, in ATC level 1, alimentary tract and metabolism, cardiovascular system, respiratory system, and blood-forming organs were the most common classes of drugs. Actually, 40% of all medications were from alimentary tract and metabolism group, and 36% were from the cardiovascular system drugs. Following tables are very detailed. I limited them to the medications which has a prevalence of at least 1% among the population. In level 2, drugs used in diabetes were the most common. Drugs acting on renin-angiotensin system were the second rank, and lipid modifying system were the third one. And all these drugs that you can see have a prevalence of at least 1% among Saudi adults. Level 3 and 4 again, level 3 drugs, blood glucose lowering, excluding insulins and analogs, and AC inhibitors were the most common classes of the drug levels 3, and in level 4, biguanides, sulfonylurea, beta-blocking agents, dihydropyridine derivatives, HNG-CoA reductase inhibitors, platelet aggregation, and selective beta-2 adrenoceptor agonists were the most common categories. And finally, these are the top 10 most common drugs for chronic health conditions in Saudi Arabia: metformin, glibenclamide, insulin, all types collectively, acid salicylic acid, amlodipine, salbutamol, simvastatin, captopril, atenolol, and lisinopril. The top 20 medications account for 80% of all medications. Now we are going to scrutinize medication used for diabetes and hypertension. For diabetes, based on history and lab results, 13.5% of population have diabetes. Based on history, 8.5% have diabetes, and only 6% taking medication for diabetes. For hypertension, the situation is even worse. 15.2% is the real prevalence of hypertension. Only 7.1% are aware of their diagnosis, and only 4.4% are taking medication for hypertension. And actually, underutilization of medication is not the only problem. Taking medication exactly as prescribed is reported by only 1/3 of population. And in some regions, such as Najran, it was very low, it was less than 20%. So this study has some messages to policymakers and managers. The study calls for action to address obvious underuse of medications for chronic health conditions, non-adherence to instruction for use of medication, and specific considerations of medication use in aged population. Also, it provides a list of common medications which has different implications for management and also education. And the other thing is that we reviewed, we did this study in a country with high income, free access to healthcare. And we reviewed diseases with well-known chronic health conditions such as diabetes and hypertension. which has multiple drugs, cost-effective, with good efficacy and available. But diagnosis is low, utilization of medication is low, and adherence to instructions is low. So just a small percentage of people have good control. This study actually, based on these facts, highlights the importance of pharmacoepidemiology, implementation science, and qualitative research, in addition to the bench-to-bed research and clinical science research in the field of pharmacology and pharmaceutics. The study was supported financially by the Ministry of Health of Saudi Arabia, and researchers had no conflict of interest for performing the study or reporting the result. If you need more details about this study, you can read this paper, which recently published in Pharmacology and Drug Safety Journal. Thank you for your attention, and I'm here for your questions.
Thank you, Dr. Maziar. Okay. There is. Okay. We have 2 minutes for questions. Yes.
Thanks a lot for the informative lecture. I'm just wondering how the adherence to the prescription has been measured.
Adherence has different scales, and there are some specific questionnaire for adherence, but in this study, we asked about the exact use of medication based on the instructions of physicians, and it was different, multiple choice questions, and actually this 1/3 of respondents were those who exactly reported that they used the medication exactly as prescribed. So even this might be over-optimistic.
Yeah, okay, exactly as prescribed regarding the regimen, whether it is given correctly or no, or over a period of time, whether they complied with the medication.
Exactly as prescribed by the physician. So yes. It's a good question. Actually, I think it's a combination of responsibilities for physician, pharmacists, and other people which are involved in the process of healthcare, and also some public education about the correct, proper use of medications, because and other things, for example, health literacy and general knowledge of the population, all of these are effective in the adherence.
Okay, thank you. Thank you.
Thank you.